The ilium itself is divided into two main parts, the wing or ala and the body. The wing is this flattened portion you see here, and the body is the central part of the ilium that you see here, contributing to the formation of the acetabulum. Now we'll discuss some bony landmarks associated with the ilium. The first one we'll talk about is the arcuate line. We've changed perspective again, so let's orientate ourselves. We're now looking at the left hip bone from a medial perspective. We can see here that it is a smooth, rounded border on the internal surface of the ilium, and that it marks the transition between the body and the wing of the ilium. It also forms a part of the border of the pelvic inlet. Another structure we can see from the medial perspective is the iliac tuberosity. The iliac tuberosity is a roughened, elevated area found posterior to the iliac fossa and serves as an attachment point for the sacroiliac ligaments. Inferior to the iliac tuberosity, we can see the auricular surface. As the name indicates, this is an ear-shaped surface, and it articulates with the sacrum. This surface is covered by fibrocartilage. Contributing to most of the internal surface of the wing of the ilium is the iliac fossa. As you can see, it is a large, smooth, concave surface found on the medial aspect of the hip bone. The iliac fossa is bordered superiorly by the iliac crest and inferiorly by the arcuate line. If we flip our hip bone over to view its lateral surface, we can see some more bony structures. The first one we'll look at is the gluteal fossa, or the gluteal surface. This fossa contributes towards most of the external surface of the wing of the ilium and provides various points of attachment for the gluteal muscles. There are three curved ridges on this surface, known as the anterior, posterior, and inferior gluteal lines. The anterior gluteal line, as we can see, travels obliquely along the gluteal surface from the tubercle of the iliac crest towards the greater sciatic notch. The posterior gluteal line descends from the external lip of the crest and ends anterior to the posterior inferior iliac spine. Lastly, the inferior gluteal line, as we can see, runs superior to the acetabular margin. Next, we're going to talk about the iliac crest, which, as I previously mentioned, forms the superior border of the iliac fossa and the wing of the ilium. The iliac crest extends from the anterior superior iliac spine here to the posterior superior iliac spine here. This crest serves as an attachment point for a large muscle of the body known as the latissimus dorsi. Lastly, we're going to look at the spines of the ilium. The ilium has 4 different spines, and the first one we're going to talk about is one I already mentioned, the anterior superior iliac spine. As I said earlier, the anterior superior iliac spine is a bony projection that marks the anterior limit of the iliac crest, and it is the origin of the sartorius muscle and inguinal ligaments. Now we have the anterior inferior iliac spine, which is a bony process found at the anterior margin of the ilium, inferior to the anterior superior iliac spine. This spine serves as the origin of the rectus femoris muscle. The next spine is known as the posterior superior iliac spine, which, as we already know, marks the posterior limit of the iliac crest. It's shorter than its anterior counterpart and serves as the attachment points for the oblique portion of the posterior sacroiliac ligaments and multifidus. Let's move on to the last spine of the ilium, known as the posterior inferior iliac spine. It is found on the superior edge of this really important structure here, known as the greater sciatic notch. If you found this quick anatomy or physiology video helpful, you'll enjoy our video tutorials even more. Click on the button and you'll see what I mean. We have hundreds of videos available to our premium members, not to mention all the fun quizzes, complete articles, and atlas sections to solidify your knowledge. Click on the button in the middle to watch the full-length video and master anatomy and physiology.